Alright, so today we are gonna do a video on a newborn assessment. The first thing that we're gonna start off by doing is washing our hands, identifying the patient, making sure that the patient matches the records and matches the mother. Alright, so the next thing that we're gonna do is go ahead and do vital signs. We'll start off with taking a temperature. The normal temperature for an infant is done axillary, and the range is 97.7 to 99.5.
Her temperature is 98.4.
Alright, then we are going to move to respirations. They should be between 30 and 60 breaths per minute.
Respirations are 40.
Okay, next we're going to assess the heart rate. The normal range for the heart rate is 110 to 160 beats per minute, and you will assess that at the apical pulse for 1 full minute.
Okay, heart rate is 156.
Alrighty, now we're going to move on to the blood pressure. The systolic should be 60 to 80, and the diastolic should be 40 to 50.
And we should use a 2.5-inch cuff for infants. Alright, her blood pressure is 78/46.
Okay, so now we will start the head-to-toe assessment. The first thing that we're going to check is the skin. We're going to check the color of the skin first to make sure that there is no jaundice or acrocyanosis.
The skin is pink and normal.
No discolorations of the skin.
No discolorations.
Alright, we're going to assess the skin turgor. When you assess the skin turgor on an infant, it should spring back immediately when pinched. The texture on a newborn should be dry, soft, and smooth. Cracks in hands and feet may be present. Peeling of the skin can occur a few days after birth. Vernix caseosa amounts, they can vary, but it is common that a newborn infant will have that. And then the final thing that we will check is the length for Lango, and that is just the fine hair, and it can usually be on the ears, foreheads, and shoulders. Okay, so some normal findings when assessing a newborn would be myela, and they are small raised white spots on the nose, chin, and forehead. They usually disappear spontaneously without the treatment. Next, we're going to check for Mongolian spots. These are bluish purple spots of pigmentation, and they are commonly noted on the shoulders, back, and buttocks.
Okay, no Mongolian noted.
Okay, so Telenik tacti nevi, stork bites. They are flat pink or red marks that easily blanch and are found on the back of the neck, nose, upper eyelids, and middle of the forehead. They do fade, so no intervention for those are needed. Nevus flamminus, a port wine stain, that is a capillary angioma below the surface of the skin that is either purple or red. It varies in shape and size, and it's usually seen on the face. But it does not blanch or disappear, so the child will have this for life. And erythema toxicoma. It's a pink rash that appears suddenly anywhere on the body of the term of a newborn during the first 3 weeks. So for this, no treatment is required.
All right, for the next portion of the assessment, we're going to go ahead and weigh the baby. You need to make sure the baby is down to just a dry diaper. Make sure you have a protective covering over the scales. The normal weight should be between 5.5 and 8.8 pounds. And this baby is 7 pounds, 5 ounces. We're going to measure the length of the newborn. So you just kind of want to keep their head straight, body flat as possible. And then get your tape measure and mark the top on the paper and then the bottom. And then you can measure that. And we have a 20-inch long baby. Okay? Also, while you're measuring, you want to measure the head circumference. And the normal circumference of the baby would be 33 to 38, 37, 33 to 37. And in this case, the baby is 35 inches, so within normal ranges for that.
Okay, so while you're doing the circumference of the head, you would go ahead and check the anterior fontanelle. That should be about 5 centimeters, and it'll be a diamond shape.
Okay.
Alright, then we will move to the posterior fontanelle. It's going to be smaller than 5 centimeters, and it'll be more of a triangular shape. Alright, the sutures should be palpable, separated, but can be overlapping. Alrighty, so next we're going to assess the ears. They should be symmetrical. If they are lower, then that can indicate Down syndrome or a kidney disorder. Next, you're going to check the cartilage. That should be firm and well formed. Also, we're going to check for skin tags on the ears.
No skin tags.
Alrighty. And the newborn infant should respond to noise or environmental stimulus. Okay, so after we assess the ears, let's go ahead and assess the eyes. They should be symmetrical in shape and size. Each eye is about 1/3. Assessing the eyes. When you assess the eyes, you want to check for symmetry and in size and shape of both of them. Each eye in the space between the eyes should equal 1/3 the distance of the inner to outer canthus of both eyes to rule out any chromosomal abnormalities such as Down syndrome. Eyes are usually blue or gray following birth. This baby's eyes are brown, but that's okay. Lacrimal glands are immature, so it's minimal or no tears. Subconjunctival hemorrhages, they can result from the pressure during birth when you expel the baby through your vaginal canal. Pupillary and red reflex are present. The infant may have eyeball movements that will seem jerky, but that is normal. And then you're going to assess the newborn's eyes. You want to make sure that they're round, reactive to light, and they can follow from outward inward to the midline. So you would assess that. The next thing that we will look at is the nose. The nose should be midline, flat, and broad with a lack of bridge. The baby can have some mucus, but no excessive draining. They are nose breathers, and usually they don't develop the response of opening the mouth with a nasal obstruction until at least 3 weeks after birth. So if you ever see flaring of the nares or cyanosis, asphyxia, that can indicate a nasal blockage. And newborns sneeze to clear their nasal passages. So you just want to make sure that the nose is just symmetric and it's no abnormalities, one-sided and bigger than the other. Alright, the next thing that we're going to look at is the mouth on the baby. You want to assess for palate closure and the strength of sucking. Lip movements, they should be symmetric. The tongue should move freely. It should not show any kind of protrusion. You want to make sure that the soft and hard palate is intact. The gums and tongue of the infant, they should be pink. Upon assessment, you can see Epstein's pearls, and they're just small white cysts found on the gums and in the junctions of the soft and hard palate. They are normal findings, and they usually disappear within a few weeks. If you notice any gray or white patches on the tongue or the gum, it can indicate thrush, and sometimes that can be acquired from the mother's vaginal secretions. When assessing the neck, it should be short, thick, and surrounded by skin folds and exhibit no webbing. The neck should move freely from side to side and up and down. Absence of head control can indicate prematurity or Down syndrome. Alright, then we would move down to the chest. Of course, we would listen to our heart and lung sounds, front and back, and you would document any abnormal sounds. The chest should be barrel-shaped. Respirations are primarily diaphragmatic. You want to assess the clavicles and make sure that they are intact. There should be no retractions noted with breathing. The nipples should be prominent, well-formed, and symmetrical. And breast nodules can be 3 to 10 millimeters. All right. Moving down to the abdomen, you would assess the umbilical cord. That should be odorless and exhibit no intestinal structures. Upon inspection, the abdomen should be round, dome-shaped, and non-distended, and you would just palpate that to make sure that you don't feel any abnormalities. And the bowel sound should be present within 1 to 2 hours following birth, so you would listen to all your bowel sounds. Assessing anogenital. First, you would just inspect the area. The anus, it should be present, patent, and not covered by any kind of membranes. For a male newborn assessment, I realize we have a female, but that should include Breguet on the scrotum. The testes should be present in the scrotum upon palpation. The urinary meatus should be located at the penile tip. For a female, you just want to inspect everything first off. the labia majora covering the labia minora and clitoris. They can usually be a little red, a little swollen, and that is normal. A vaginal blood-tinged discharge can occur in a female newborn. That's usually caused by maternal pregnancy hormones. A hymenal tag should be present. Mecium should be passed within 24 to 48 hours after birth. So you just want to monitor intake and output, and urine should be passed within 24 hours birth. You do want to monitor the color of it. For the first couple of days, the urine can be a rust color, and that is normal. Extremities. You want to assess each extremity for full range, symmetry of the motion, and any spontaneous movements. Extremities should be flexed. You want to assess for bow legs and flat feet, and they are normal findings because lateral muscles are more developed than the medial muscles. No click should be heard when abducting the hip. Gluteal folds should be symmetrical. Soles should be well lined over 2/3 of the feet. And the last thing that you want to check is that the nail beds are pink, and just make sure that there's no extra fingers or toes. So after assessing that, we're going to check the newborn's spine. The spine should be straight, flat, midline, and easily flexed. So you're just going to run your hands down. Alrighty. When assessing the senses, the first one that you're going to look at is vision. The newborn should be able to focus on an object that is 8 to 12 inches away from the face. The eyes are sensitive to light, so newborns actually prefer dim lighting better. The pupils are reactive to light, and the blink reflex is easily stimulated. The newborn can track high contrast objects, and they usually prefer bright colors and patterns. Term newborns can see as far away as 2.5 feet. Hearing. Hearing is similar to that of an adult once the amniotic fluid drains from the ears. They do exhibit selective listening to familiar voices and rhythms of intrauterine life. And a newborn will usually turn towards the sounds and touch. They should respond to tactile messages of pain and touch. And when assessing this, the mouth is the most sensitive area to touch in the newborn. Taste. Newborns can taste, but they do prefer sweet to salty, sour, or bitter taste. Smells. Newborns do have a high developed sense of smell. They usually prefer sweet smells, and they can recognize the mother's smell. Habitation. So this is a protective mechanism where the newborn becomes accustomed to all the environmental stimuli. This is very important as the child grows to avoid overloading the child with stimuli.